With all of Washington waiting with bated breath tonight for one of the last health reform dominoes to fall. That domino is the official score from the Congressional Budget Office on the revised health reform bill, the CBO's official unbiased assessment of how health reform is going to affect the deficit. That CBO score could come out any minute now. Nobody really knows. It was expected to be released sometime this afternoon, then it was going to be sometime late tonight. Now our best vaguely informed guess is to expect that CBO score to come out sometime tomorrow. Get ready, America, here it comes. And here's why you care about it. Once the CBO finally releases that score, House Democrats get to start the big 72 hours till a vote countdown clock. House Speaker Nancy Pelosi has pledged to delay any votes on that health reform package until 72 hours after the CBO score is made public so everyone can read it. So tomorrow plus 72 hours means that a final vote in the House will likely take place sometime on Sunday. After the House votes, the next step is for the Senate to pass its fixes to the bill. It's not exactly clear how long that process will take, but the aim is to wrap it up by the time members of Congress leave for the Easter recess. After that happens, the bill will be passed on to the White House for President Obama to sign it into law. As soon as President Obama signs health reform into law, it will be a whole new world for health insurance companies and for those who have had to battle health insurance companies to get the coverage they need. Now, all of this could change a little bit since nothing has been signed yet, so I can't tell you from the exact language because we don't have the exact language yet. But as best as we can tell from the proposals on the table, here's what's going to happen. Within 90 days of health reform being signed into law, those who have been denied coverage because of some pre-existing condition will finally get a path toward coverage. They will have immediate access to care through high-risk insurance pools created by the government. That's first. If you can't get insurance now because of a pre-existing condition, you will get some relief within 90 days of the bill being signed. Another 90 days after that, it will be illegal for insurance companies to deny kids coverage because of their pre-existing conditions. Also, children will be allowed to stay on their parents' health care plans until they are 26 years old. Insurers will also be banned from imposing lifetime limits on health insurance benefits. Insurers will also at that point be banned from rescinding your insurance, rescissions they call it, taking away your insurance when you file a claim. All of this will happen within 6 months of President Obama signing health reform into law. Next stuff that happens as of the next calendar year, as of January 1st. At that point, if you're on Medicare, you will qualify for free annual wellness visits. Also at that point, insurance companies will essentially be required to spend 80 to 85% of what they take in from you in premiums on actual medical care. Imagine if they don't spend 80 to 85% of what you give them in terms of premiums on actual medical care, they will have to refund you the difference back. Also, if they want to hike your rates, they'll have to announce it. Then they'll have to justify it, and that apparent justification will have to be reviewed. They won't just be able to automatically, unilaterally raise those rates anymore. All of that happens as of next year. Then after that, after all of that, in 2014, it will no longer be legal for insurance companies to deny anyone coverage based on pre-existing conditions, period. So kids with pre-existing condition goes into effect very soon. It is by 2014 that it goes into effect for everyone. The health insurance exchanges at that point, for people who don't have coverage, will also be up and running by that time. And in addition to the ban on lifetime limits on benefits, which goes into effect shortly, insurers in 2014 will be banned from imposing annual benefits, annual limits, yearly limits on your benefits. So this is all those things I just described, this is all in motion. This is all happening right now. At this point, it's just a matter of waiting for that CBO score to come out. And as much as they have tried, Republicans have not been able to stop health reform from going forward. And in defeat, reform opponents have been getting a little hysterical, in both senses of the word. Following on the great success of yesterday's Drive in a Circle and Honk Day, Today, some members of Congress decided to double down on their argument that it would be unprecedented and unconstitutional for Democrats in the House to pass reform on Sunday because they might want to do so using a tactic that Republicans have used over and over and over again. The number 3 House Republican, Mike Pence, told the conservative website The Daily Caller today that this so-called Deem and Pass rule, this thing that they want to use to pass health reform this weekend, Mike Pence said it's, quote, probably unconstitutional. Get this, Mr. Pence then faces the uncomfortable follow-up question, quote, well, Democrats say you voted for these rules yourself on 3 occasions. Mr. Pence responds, quote, yeah, sure. Yeah, sure, I voted for this thing. But when they do it, it just seems so unconstitutional, seemingly. But not when I do it. Don't you see the difference? Republicans are trying to make the case that the self-executing rule, this Deem and Pass rule, they're trying to make the case that it is unconstitutional. They themselves have used it more than 200 times over the past 15 years. But if you want to perfectly capture how much the opposition to health reform has fallen apart at this point, now that health reform is going to happen, watch this. Watch the knot that Republican Congressman John Shadegg of Arizona ties himself into as he tries to explain his opposition to health reform today on MSNBC with my friend David Schuster.
The insurance industry, the for-profit insurance industry, wanted an individual mandate.